Renewed concerns about kids football following several incidents involving young players in New Jersey. Thank you for staying with us. I'm Erin LeBeau.
I'm Corey Chambers here for Tamsin. Traumatic injuries are becoming an alarming trend on school football fields. Just last month, a 16-year-old suffered a fatal head injury while turning a kickoff for Linden High School. And two other teens suffered injuries to their spinal cords in separate games as well. It's raising questions about the dangers of contact sports, especially when it comes to head injuries and concussions.
Yeah, so joining us now to talk about it is Dr. Avi Ronai, a pediatric neurologist who specializes in concussions. Thank you for joining us.
Thank you so much for having me.
Okay, so doctor, can you begin by explaining what a concussion is and how serious can they be?
So a concussion is a type of traumatic brain injury that can be caused by either a direct hit to the head or neck or elsewhere in your body that results in biochemical changes, inflammatory changes to the brain cells, leading to a multitude of symptoms such as headaches, dizziness, concentration deficits, mood instability, and sleep dysregulation. These symptoms may last from days, several weeks to months, but as opposed to more serious traumatic brain injury, concussions are thought to be the mildest of traumatic brain injuries, and they should be short-lived as long as the appropriate care is provided.
Okay. So, first of all, when you describe a concussion as a traumatic brain injury, I think that alone is a bit alarming because you understand this is not just a thing. It's not just a concussion. No, it's a brain injury. It's not as severe as other brain injuries, but it's a brain injury, which is what you just said. So how do you best deal with that? Because, again, you said at the mildest you can treat it, and it can sort of, the effects can go away. So what's the best way to have that happen?
So one of the ways to treat a concussion is, first of all, you need to be able to recognize when someone gets injured. And when someone gets injured or there's a concern that the injury happened, the best thing to do is remove that person from that specific activity in order to prevent re-injury or worsening of symptoms. The other thing that we need to address is that when someone already has a diagnosis of a concussion, it is important to reduce the amount of activity and reduce the amount of energy demand that is required from the brain, followed by rest and a gradual reintroduction into activity, because not all the symptoms may occur right away. There's a natural progression to a head injury that the more energy we demand from the brain, the more symptomatic someone may become. Now, some of the signs of a concussion that we may see is temporary amnesia, so not being able to remember what happened during the injury or after the injury, confusion, balance problems, which means that the patient might look a little bit clumsy. They may be slow to respond. They may have changes in behavior. Sometimes some patients may be more irritable at times, and then loss of consciousness, which is actually not required in order to diagnose a concussion, but can happen.
So, doctor, we know a lot of people associate concussions with football, and it's one of the more popular sports among student athletes. So what would you say to a parent who may be concerned that their child may injure their head in some way from playing?
So when discussing with parents that are concerned that their children might get injured from a concussion, it's very important to educate and increase awareness of what a head injury is, the signs, the symptoms, and the red flags that may point to more serious traumatic brain injury. It's also very important to have open discussion and be very transparent about the benefits and the risk of their children participating in team contact sports.
I'm just curious, and I don't know, your situation. I don't know if you have a family, if you have kids or whatnot, but I'm curious, would you want your kids playing football?
I think that it is very important for our kids to take part in sports. I think we should encourage our kids to participate and be healthy, and not just from the physical state, but from the mental state.
But in football specifically, because obviously there's lots of sports that aren't necessarily as, the contact isn't the same way.
So football, it does put you in a higher risk for more serious traumatic brain injury from concussions. From, I have 3 daughters. Hopefully one day they can play in the NFL. But everyone is a little bit different. I think we all have to understand where our goals and what is important to us. The camaraderie from football, from team sports, is also very important to a lot of people. So it's really family dependent, but we need to understand that there is a risk that we can get hurt, and we have to understand the repercussions from it.
Okay, so doctor, do you always have to seek medical attention after a head injury?
So this is a very interesting question that it's asked frequently. And if you're talking about the immediately after the injury itself, if you're noticing worsening symptoms such as headaches, continuous vomiting, seizures, abnormal eye movements, abnormal movements, then it would be to your advantage to seek immediate medical attention from a medical practitioner that understands traumatic brain injury. However, if this is not the case, and as not all head injuries are made equal, they may not require for someone to seek medical attention at that time. But if parents or the athlete is concerned that there's something wrong, they should seek medical attention, because it's better to err on the side of caution.
Yeah, and we talk about complications, and I know you were saying that concussions, at least, are on the milder scale of brain injuries. But then we think about CTE, which we see NFL players, we see people literally changing behavior after a series of concussions. So I just wonder, what is it like a scale? How does it work?
So there's different types of complications that can occur from concussions or from head injuries. In regards to concussions themselves, you can potentially have something called post-concussive syndrome, which the definition is basically symptoms that are lasting longer than a month. You can also have post-traumatic seizures, which is something fairly common that can either occur immediately after the impact or days afterwards. You can have convulsive motor phenomena or changes in movements that are different, which we have recently seen in professional football players. Second impact syndrome is something that people have been that are aware, and it's something that can happen if you get re-injured close to the initial injury. Mild cognitive impairment, and of course chronic traumatic encephalopathy is something that we see later on in life, and sometimes post-mortem.
Wow. That whole list is awfully scary. Can I just go on record as saying, as you go down the list, there's nothing good on that list. Not a single good thing.
But that's why, understanding head injuries, that's why it's very important to increase awareness and education.
All right. Well, Dr. Ronai, thank you so much for joining us today. We appreciate it.
Thank you so much.